Assalamualaikum and very good day to all the panelists, and I wish you all are in the pink of health. My name is Farihin, Shuhaimi, and I'm excited to meet all of you today. And I would like to thank you all for taking the time to join us for today. Without further ado, let's begin with introducing our distinguished panelists. First, we have Dr. Fakhrul Radzi, a dentist at Pusat Kesihatan University, and Dr. Fakhrul Radzi has over has over 8 years of expertise in treating patients and has several successful research projects that have been published. And for our second panelist, we have Mr. Afiq, a financial advisor and founder of Smart Finance Academy, and he focuses on empowering young entrepreneurs to take control of their finance through education. Uh, Then we have Dr. Iqmal Shafiq, our psychologist that has over 15 years of expertise in his research. And finally, we have Dr. Adam Harith, a lecturer from University Malaya, who has been teaching food science at numerous universities for over 70 years. As we all know, following the pandemic COVID-19, most people are concerned about their health and seek various ways to enhance their health and lifestyle. However, some people are still in awe with what to do to improve their health and their well-being. That's our topic for today is pathway to good health and well-being, achieving SDG3 together. We aim to have an insightful and engaging conversation about ways, misconception, and the benefit of taking care of our health. So my first question is to Dr. Fakhrul. As a dentist, oral health is one of the biggest contributions to overall well-being. So my first question is, why is it vital to take care of our oral health?
Okay, thank you for the question. First thing first, I would like to say thank you for inviting me to this panel discussion. First thing first, I believe that oral health should be highlighted in this panel discussion. This is because even though oral health did not mention thoroughly in Sustainable Development Goal 3, but I believe it is still related to health because it is a link to our oral health. So the question is why it is vital to improve our oral health. This is because, firstly, mouth is one of the vital parts in our life. So we do our daily basis using our mouth, such as eating and talking. So it is sensible or it is vital for us to improve or to take care of our health. By having a healthier mouth, our life will be much more easier so we can work so our mouth can function normally. So nowadays, um, most people did not take care of their mouth um, because of the reasons that they didn't have time to um, to take care of their mouth, like brushing teeth or something like that. But I believe uh, they have to take care of their mouth because this is important in order to avoid any diseases like mouth cancer or tooth decay that can cause a serious health effect on their life, such as, for example, if someone have uh, let's say they have a oral cancer, they will they they will have a hard time to do basic things in their life, such as eating, because they will feel pain in their mouth. So that's why I think it is vital for us to improve our health, as it is also linked to our topic discussion, which is health and well-being. Yes, I think that's all my point.
Thank you, Dr. Fakhrul, for your inputs. And next, I want to ask Dr. Harith, as a nutritionist, what aspect do you think was the main cause to achieving good health and well-being?
Thank you for Dr. Farihin for asking me this question. From my point of view, the first aspect that across in my mind is, of course, by consuming a balanced diet. By consuming a balanced diet, we can get a good health and have a very healthy body. For example, we need to take a lot of vegetables and eat some good food, and let's say that we need to avoid some processed food or some fast food. Also, I want to add that in this particular days, most of the fast food was really harmful to us, even though if we rarely eat it, but those kind of food were really dangerous for any types of communities like children, the youngsters, and many more. That's all from me.
All right, thank you for your inputs. And furthermore, I would like to ask Mr. Afiq, what do you think, what steps that we can take to make healthcare more affordable for everyone?
Okay. Firstly, I want to thank you to our moderator, Mr. Farihin. In order to we get uh, achieving the pathway to good health and well-being, we need to uh, we we were required to addressing the financial and social barriers that prevent equitability access to health and services. So nowadays there are many groups of people unable to afford uh, the healthcare that which lead to the further inequalities. So for us so the step that we can take to make healthcare that are more affordable to to everyone is firstly we can do a subsidized healthcare program to make health more affordable. Next, we can also bring a community-based health in initiative to reach the undeserved pollutions. And lastly, we also might be doing the integrating social protection policies that to elevate the healthcare costs for vulnerable groups. So I pass back to our Mr. Moderator.
Thank you for your inputs. And next, I would like to ask Dr. Shafiq, because there's a lot of misconception about mental health. So, what are some common misconception about mental health, and how can we address this misconception, improve overall well-being?
Thank you for your asking for me. For my point of the view, common misconception about mental health include belief that mental illness are sign of personal weakness, that they are uncommon or only affect certain people, a group of people, and that individuals should simply snap off it or rely on willpower alone to recover. This myth not only perpetuates stigma but only discourages individuals from seeking the help they need, often lead to delay in treatment and worsening symptoms. Addressing this misconception through will spread education, uh, Public awareness campaign and open conversation can significantly improve overall well-being by fostering a culture of understanding and empathy. For instance, initiatives like the Time to the Change campaign in the UK have demonstrated that sharing personal story of mental health challenge can reduce stigma and encourage more people to seek support. Furthermore, research published in book which the Lancet Physiotherapy highlight that when individuals feel support and informed, they are more likely to engage in early intervention strategy as a personal resource and adopt health campaign mechanism, ultimately leading to better mental health outcome and more inclusive society. Yeah,
All right, thank you for your input about the misconception in mental health problem. So, since Dr. Fakhrul talked about the benefits of taking care of oral health, so I would like to ask what are ways to take care of oral health and ways to improve as well as maintaining oral health itself?
Okay, thank you, the moderator. And that is a really good question. So there are many ways I believe that can improve our health, but I believe there are three best ways to improve it. First thing first is brushing the teeth. This is one of the most common way that we know that that can improve our health, and it is also the most effective, I believe. Uh, One of the most effective way to improve our health. This is because we brush our teeth in order to get it out of the food that gets stuck between our teeth. For example, if we uh, eat a food, some of course there will be some part of the food that will stuck uh, between our teeth, and sometimes they will stuck at the back of the teeth or at the back of the mouth, which is hard for our hand to get it out of it. So that's why we brush teeth. Also, it is important to so that food will not just let it to so the food that uh, will will feed the bacteria that that can cause some um, severe diseases in our mouth. Also, I recommend to use toothpaste when brushing teeth. This is because toothpaste contain fluoride, which can prevent our teeth from decay. So there are uh, quite huge difference if we brush the teeth using toothpaste and not using toothpaste. Toothpaste, if we brush the teeth using toothpaste, um, our teeth will get some sort of like I will say shield because as I said earlier, uh, toothpaste contain fluoride, which can make our teeth resistant to decay. But if we brush our teeth without using any toothpaste, we are only just brush it off, brush brush the food waste that is stuck between our teeth. So we won't get any some sort of like protection to our teeth. So that's the first way to improve and maintain oral health. Secondly is having a healthy diet. Um, Having a healthy diet also is vital for our health. It's not only for body. Some people always thought that healthy diets is only for body, but it's not. It's also for the our mouth as well. This is because food and drink that we consume every day can give effects to our health. For instance, sugar in most of beverages today can cause damage to the teeth if we consume it daily. This is because sugar can feed the bacteria in our teeth, which can lead to tooth decay. So I recommend to have a healthy diet, such as um, drink milk. This is because milk contains calcium, which can strengthen our bone, also strengthen our teeth as well. Um, for the last way, I believe to improve our health is giving easy access to oral care. This means that everyone should have an access to oral care more easy. The problem is that some of the people, uh, especially those who live in impoverished areas or in rural area, have some difficulties in order to gain access to oral care. This is because of their poor conditions and their location. Nowadays, for example, many oral care facilities nowadays only available in um, urban areas. But none of them are built in rural areas, which means that it is hard for people that live in rural area to get oral care. So that's why I suggest the government should invest or build more health facilities that includes oral care in rural areas or in impoverished areas, so everyone can get the same treatment, so they can improve their oral health, not only for people that live in rich urban area, but also people live in rural area should get the same treatment as the people in the city, so everyone can get same treatment. So I believe that those are the three ways that are vital to improve oral health as well as maintain it. So that's all.
Right, thank you for your input. And since you mentioned about healthy diet, I would like to ask Dr. Harith more about what is the point to have a balanced diet.
Thank you for Dr. Fakhrul and Mr. Moderator. From my perspective, by consuming a balanced diet can let us to have a healthy body. There's some point or ways to have a balanced diet. The first one, by follow the food pyramid. As we know, the food pyramid has their own tiers, just like the vegetable and the carbohydrate, the fruit and vegetable was the lowest, and then follow up by the carbohydrate, and then by protein, and then the tiniest one was the sugar and oil, which is fat. And the second point was we need to less intake of sugar and oil. Just like from the food pyramid, there are only 5% of sugar and oil. This is because they contain a lot of fat. If we take more of it or take it regularly, our body will have a lot of fat and it will lead us to have an obesity. So when our body have lead to obesity, can we can eagerly to have some diseases like diabetes, stroke, and sometimes a heart attack. And the last one from my point was we need to avoid from taking the processed food and fast food, just like what I'm saying from the beginning, from the starting of this time. From what we know, most of the fast food and processed food was not really a good food. For example, like the patty burger is not 100% a meat of the animal. Sometimes it can contain from bones, heart, and eventually can their poop. So when I think of that, it made me so. Mm. So for the fast food, we can eat it, but just minimize it and don't take it too much. Same for the mostly for the youngsters and child. And I will also want to advise for the parent out there, don't let your kids to take many fast food and processed food. That's all from me.
Thank you, Dr. Harith, for your input. And since Dr. Fakhrul also mentioned about rural areas, so I would like to ask Mr. Afiq about how can community program help people in rural area or underserved areas to get better healthcare?
Okay. Um, Thank you very much, Mr. Moderator. So when we talk about rural area or undeserved areas that people live in one of articles that's the title Good Health for All 2020 by Dr. Shirley Gatiano Gebel, Associate Professor at Fordham University's Graduate School of Social Service. She was right that in 2017, only between one third and one half of the world population had access to essential health services, and many lack basic necessities like clean water and sanitation. So for us, uh, uh, to help them by doing a community program, firstly, we can do the community-based health initiative, like one program from China. They will call barefoot doctors that train locals community members to provide basic healthcare uh, and and focusing on preventive care, hygiene, and and minor treatments. Next, we also can have a volunteer organization. It's like the initiative in Malaysia. We have Malaysian Red Crescent that help by organizing health drive such as blood and organ donation to support healthcare. And lastly, we also can have the localized solution by engaging with communities directly, help address specific health challenge, improve awareness, and promote healthy behavior by making healthcare more accessibility and effective in underserved areas. That's all. I pass back to Mr. Monster. Thank you.
Right, thank you for your input. So I would like to ask Dr. Shafiq again, because environmental factor really play a major role in people. So what do you think? What ways do you think that communities can do to create a supportive environment?
Uh, from your question, my answer is our environment sectors such as social economy, housing stability, access to healthcare, um, exposed to violence or trauma, and even the availability of green space play a critical role in shaping our mental health. Why I say this? Because in this book that I study in published, which is the title of the book in the Lancet, Physiatry, have shown the individuals living in poverty or unsafe neighborhood are at a significant high risk of developing conditions such as anxiety, depression, and post-trauma stress disorder. In short word, is PTSD. Additionally, lack of the access to mental health service or social support system can exacerbate this challenge. Community can address this issue by prioritizing initiatives that promote mental health equity, such as providing affordable housing, increasing access to mental health care, and creating safe and inclusive public space. For example, urban planning that incorporate park and green space has been linked to reduce stress level and improve mental health. As reported in study in environmental research and public health, by addressing this environmental factor holistically, community can not only reduce mental health disparity but also create environment that foster resilience, social connection, and overall well-being for all residents in their surrounding. That for me.
Thank you for your inputs. And for last round, I would like to ask Dr. Fakhrul again about how can you prove that your point will improve people oral health?
Okay, thank you for the question. So let's go back to my 3 points earlier to the ways that improve to improve our health. Firstly, for brushing teeth. So according to World Health Organization (WHO), it is encouraged for a person to brush their teeth twice a daily. This means that they have to brush their teeth 2 times a day. I recommend to uh, brush the teeth uh, uh, in the morning and also before the sleep. This is because if when we brush our teeth in the morning, we can get rid out of the food that gets stuck um, in our teeth the night before. Also, it is also clean our teeth because we in the morning because we need to face more um, we need to face the day, and also after the day ended, we might as well eat some food during that day. So that's why we need to brush the teeth before bed, so we can avoid any bacteria activities in our mouth. So also, I also said earlier that we have to use toothpaste. According to WHO as well, toothpaste, the fluoride in toothpaste um, contain sorry, we need to use uh, toothpaste that contains fluoride from that from 1000 to 1500 parts per million, which stands for standard concentration of fluoride in regular toothpaste. Now, these toothpaste uh, are sold are sold in many markets. Also, it is recommended to buy um, toothpaste that contain fluoride, so we can protect our teeth from from getting tooth decay. So that's the proof for the first way, and the second way, which is healthy diets. So according to National Institute of Dental and Craniofacial Research, bacteria in mouth can form a thin layer of plaque over the teeth. This plaque this bacteria will react to sugar that is present in the food and drinks. So this reaction triggers the release of an acid that can damage our teeth. So that's why I said it is vital to uh, to 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 not take a lot of sugar or any dangerous substances that are in the food or drinks, so we can protect our teeth from getting destroyed by these substances. Also, from avoiding any bacteria reactions that can make our teeth decay. So it is also linked to brushing teeth. How it is linked to brushing teeth? It's linked to brushing teeth by brushing. We have to brushing teeth more frequently. Also, we need to we need to less consume sugar. Also, junk food as well, so we can have a healthier teeth. Also, I also said that earlier. We have to drink milk. This is because milk contains minerals. These minerals will protect the teeth from when the acid in the bacteria is trying to break the mineral. So this mineral, alongside with the toothpaste, can form some sort of shield or protection for our teeth. So it can make our teeth more decay resistance. So for the last part, for the last way is easy access to oral care. So according to Central of Diseases Control (CDC), residents in rural area face challenges in accessing preventive dental care. Data shows that people in rural areas are 5% less likely to receive preventative dental care than those in urban settings. This means that um, that's why I said that earlier. It is vital to make more or build more facilities in rural areas that includes oral care or oral treatment, so people in rural area can get more preventive dental care. So or they can have easy access to oral care. So yeah, that's all of my point.
Thank you for Dr. Fakhrul. Since we do not have a lot of time, so I hope my next question is to Dr. Harith. What is the benefits of healthy diet? And I hope that you can speed up. Wait.
There are some benefits of having a healthy diet. The first one is it can support our overall health. By consuming a healthy diet, it also make our bodily function. For example, our blood will circulate smoothly and anybody else. The second one is it can also reduce the chronic diseases such as what I mentioned earlier, which is diabetes, heart attack, and sometimes stroke. By having a healthy diet, such as take a lot of vegetable, a good amount of protein, and a less amount of sugar. By taking a less amount of sugar it also can minimize by can minimize the getting of the heart attack. And the last one, it also can improve our mood and our mental health. By taking a good health, taking a balanced diet, it can boost our mood. For example, by drinking a lot of water every day and take a very lot of vegetable, it can make ourselves be happy in the morning, in the and every all day long. That's all from me. Thank you.
Right, thank you, Dr. Harith. So next, I would like to ask Mr. Afiq again. What innovative financing mechanism can government and private sector explore to ensure the sustainability of universal health coverage?
Okay. The innovative of financing of finance of financing mechanism can that government and private sector can exploit is firstly the progressive taxation. So the government can adopt the progressive tax system to fund to ref, to fund universal health coverage programs to ensuring that those with higher incomes contribute more. Next, by doing the healthcare insurance models, programs like Ayushman Bharat in India or in in Thailand, universal health insurance scheme. They are pool resources through national insurance schemes that can reducing financial hardship for citizens. And lastly, by doing a public-private partnership, the collaboration between government and private sector can help share costs, provide subsidies, and expand healthcare infrastructure. So that all from me. Thank you.
All right, thank you for your input, Mr. So last question I would like to ask Dr. Shafiq again. Why is it mental health education is important in school for students?
Um, from your question, why the mental health education important in school is because mental health education in school is essentially because it helps students develop the skill to recognize and manage their emotion, understand the importance of mental well-being, and seek help when needed. Research published in Child Development emphasizes that early education on mental health can reduce stigma, promote emotional resilience, and improve student ability to cope with stress. By incorporating mental health topic into the curriculum, uh, school create a support culture when students feel safe discussing their struggling and are more likely to seek help without fear of judgment. This proactive approach can also improve academic performance as mental health challenges are a leading cause of absenteeism or poor concentration in students. Beyond the classroom, the benefit extend to society as a whole. Education young people about mental health foster a generation that value emotional well-being, reduce the prevalence of untreated mental health conditions, and promote empathy and understanding in interpersonal relationship. Programs like mental health first aid have shown that when the school invests in mental health education, they equip students with lifelong skills that contribute to healthier community and more supportive society. That is for me.
Sorry, Amit. Thank you for the Shafiq, and I would like to thank you, all of you, for your active participation and valuable contribution to today's discussion. It's been a pleasure to hear such a wide range of insight and perspective on our topic, which is good health and well-being. So I hope that we can meet in another session that in the future. Okay, bye bye.